Hello everyone, this is James Rowe, the Administrative Officer of Healthyi project in the Strategic Planning team. Today, I'm gonna talk about the research I've done about Rwanda. For the table of contents, there are basic information, culture, history, healthcare structure, and NTD-related disease or information. For its location, Rwanda is situated in African Great Lakes region, and it is bordered by Uganda to the north, Tanzania to the east, Burundi to the south, and Democratic Republic of Congo to the west. And Kigali is the capital and the largest city of Rwanda, and Rwanda has a total land area of around 26,000 square kilometers. For the population, Rwanda's population stands at approximately 13.78 million people, and its population is relatively young, with the median age of 19.4 years old. Also, the official estimate for Rwanda's GDP was about $34 billion at the end of 2023, and it is ranked at around 141 place overall. Central to Rwanda culture is the concept of Ubuntu, which emphasizes the interconnectedness of humanity. For example, when a family lost a home due to a disaster, then the community would offer shelter, food, and emotional support together. And the official language of Rwanda are Kinyarwanda, French, and English. Among them, Kinyarwanda is the most widely spoken language and is an essential part of Rwanda identity. In the aftermath of 1994 genocide, Rwanda implemented the Gacaca justice system, a traditional community-based approach to justice. So in this justice system, the accused are encouraged to confess their crimes and seek forgiveness from the community and in particular from the victims or their families. And for religion, the majority of Rwandans are Christians, with a significant portion being Roman Catholic. And traditional beliefs also coexist with Christianity, contributing to the diverse religious landscape. For the history of Rwanda, during the 19th century, the Kingdom of Rwanda achieved significant territorial expansion under the leadership of Tutsi monarchy. And during the colonial period, Rwanda came under German colonial rule as part of German East Africa. And then, Rwanda gained independence from Belgium, but soon after, the genocide against the Tutsi took place, where approximately 800,000 Tutsi and moderate Hutu were killed in 100 days. And soon, Rwanda began a process of reconciliation and rebuilding, and now finally, Rwanda has made significant progress in economic growth, healthcare, and gender equality. Let's talk about Rwanda's healthcare structure. For the public sector includes government organizations such as Ministry of Health. Rwanda's primary healthcare strategy aims to improve access to essential and life-saving health services by bringing greater numbers of health posts close to communities. And for the private sector includes privately owned businesses and organizations. The Rwandan government has been working to increase private sector investment in the country with a focus on public-private partnerships called PPPs. And these partnerships aims to leverage the strengths of both the public sector and private sectors to achieve development goals. There are several benefits of public-private partnerships called PPPs. First, efficiency and innovation. PPPs often bring together the efficiency of the private sector with the public sector's responsibility for the public service delivery. And this collaboration can lead to innovative solutions and more effective service provisions. Second, access to private sector expertise. Public sector partners typically bring specialized skills, technology, and management expertise to the partnerships. And this can enhance the quality of service and infrastructure projects as the private sector often has experience in similar ventures. Third, faster project delivery. PPPs can expedite delivery of projects as private sector partners are motivated by profitability and are often more agile in project execution compared to traditional government processes. Fourth, PPPs can leverage private capital for public projects, reducing the burden on public budgets. Private financings can be particularly valuable for large-scale infrastructure projects that require significant investments. For the Rwanda's healthcare situation, Rwanda has made primary healthcare a priority to improve access to health services and make progress toward universal health coverage, called UHC. And according to the WHO, Rwanda's healthcare system has made significant progress in recent years, with healthcare coverage jumping tenfold from less than 7% to nearly 74% from 2003 to 2013. While there are still underprivileged people in Rwanda, the government has been working to increase private sector investment in the country with the focus on private-public partnerships, PPP. And the government goal is to ensure that by 2024, people will need to walk less than 24 minutes to visit a health facility. And to achieve this, Rwanda has established health posts closer to communities. And these health posts serve as an interface between community health workers and health centers. The health posts have also played a crucial role in the effective national response to COVID-19, ensuring that communities can access basic care even during the crisis. Since there are still NTDs in Rwanda, in June 2022, Rwanda hosted the Kigali Summit on Malaria and NTDs. The summit was a key opportunity for the world leaders to demonstrate their commitment to ending malaria and NTDs. The NTDs in Rwanda include SDH, SCH, scabies, and other diseases. And for the NTD-related policies in Rwanda, first, there is Kigali Declaration on NTDs. Launched in Rwanda, the Kigali Declaration on NTDs aims to mobilize political will and secure commitments to tackle NTDs. Its goal is to achieve the target sets for SDG 3 and the WHO's NTD roadmap that is planned from 2021 to 2030. Next is Strategic Plan for NTDs, 2019 to 2024. Rwanda developed a comprehensive NTD strategic plan to guide its efforts in controlling and eliminating NTDs. Key components of this plan include nationwide mapping for intestinal worms and schistosomiasis, integration of NTD control efforts into national health plan, and organizing integrated MCH weeks. Next, the relationship with Korea. Rwanda and South Korea established diplomatic relations on March 21, 1963. And in 2022, the Republic of Korea's Country Partnership Strategy for Rwanda was released, which aims to support Rwanda's long-term national development plan. Last, the current situation in Rwanda. Currently, there's no ongoing war or movements in Rwanda. As for the safety of the country, it is generally considered safe to travel to Rwanda. And the country has made significant progress in terms of security and stability since the 1994 genocide. That was it for Rwanda research, and thanks for listening.